Hello and welcome everybody to this webinar, which is aimed at social prescribers and link workers to provide them with extra support around advocating sport and physical activity while we are in COVID-19 and the coronavirus situation. My name is David Reader. I'm from London Sport. I'm the Special Advisor for Workforce, and I'll be joined today by my colleague Barry Kelly, who's a Specialist Advisor for Health and Physical Activity, and our guest presenter and who's worked on this course for us today from the University of Kent, Dr. Sarah Hotham. This short webinar is a supplementary opportunity for those who have already received the one-day training session, which is aimed at social prescribers and link workers, which helps them advocate sport and physical activity. However, if you've not received the one-day training course, hopefully this one short webinar will still be of some use, and I hope you'll find it useful. And at the end of the webinar, if you think you would like to receive the one-day workshop, then please do make contact with us, and we'll give that information of how you can do that at the end. And now, without further ado, I'm going to hand over to my colleague Barry Kelly, who's going to start the session off.
Thanks, David. There are, as you can see from the slide, there are 5 main objectives from the session today. The first one is how to highlight COVID-19 both presents new challenges and opportunities to improving physical activity, to identify the role of the link worker in navigating the new landscape, to emphasise key effective behaviour change techniques used to promote physical activity, and consider how the impact of COVID-19 can be reflected when using these, identify sources of trusted information on the role of physical activity in the recovery from COVID-19, and share patient resources developed specifically for COVID-19 response. Next slide, please. So it's probably worth starting by reminding ourselves of the benefits of physical activity. We know that physical activity can help in the prevention and management of over 20 health conditions. This public health infographic on the slide highlights the reduction in risk for a number of health conditions if we achieve the recommended amounts of physical activity. And just to pick out a few, we can cut a risk of type 2 diabetes by up to 40%, cardiovascular disease by up to 35%, and depression by up to 30%. We should also keep in mind that people often have comorbidities, that is the presence of more than one health condition. So the benefits of physical activity in reducing these risks are evident and also more crucial during this global pandemic, specifically given the risk to people with long-term conditions. Next slide, please. Quite clearly, physical activity has taken on a new importance during the COVID-19 pandemic, mainly as a result of lockdown and some of the other restrictions that have been put in place. And just to highlight some of the information that's come to light, changing attitudes and social norms. Data from Sport England shows almost 2/3 of adults consider exercise to be more important than ever during the current coronavirus crisis. And this has also led to new habits and routines for some, and it's important to emphasise for some. Younger groups are more likely to have done more activity in the past week, 43% for those aged 16 to 34, versus 22% for those aged 55 plus. The Sport England work has also found that people in higher socioeconomic groups are more likely to have done more activity in the past week, 34%, than those in lower socioeconomic groups. And there's also some variations in terms of the differences between people living in urban and rural areas. It's also important to acknowledge that there have been variations with some groups disproportionately impacted by the pandemic. This includes people with disabilities, people with long-term conditions, and some BAME communities. These are inequalities that were evident before the pandemic and continue. And obviously this has thrown up a number of challenges more generally. So people have been forced into a change of behaviour, i.e. through lockdown. and the risk of disrupting strongly formed habits when opportunity to engage in physical activity is potentially reduced. People become fearful of engaging in physical activity outside the home for the obvious reasons associated with risks, and specifically for those that have been shielding or self-isolating. And there clearly are challenges in how to engage a diverse range of populations and appeal to groups with typically higher levels of physical inactivity. And that moves us nicely on to the next speaker, which is Sarah, who will cover that in a bit more detail.
Thank you, Barry. So as Barry has highlighted, we have seen some sections of populations have increased their physical activity. However, Sport England are also very mindful that people with long-term health conditions may have struggled to do any type of physical activity during sort of the pandemic period. So in recognition of that, Sport England, along with the We Are Undefeatable campaign, did some insight work where they surveyed people with long-term health conditions to sort of get a better sense of understanding around what physical activity they had engaged with over the lockdown period, but also try to understand some of the worries and fears that they might have. So from this work, what they have sort of found, I guess the headline findings, was that COVID-19 has exacerbated the inequalities that were already prevalent within those populations before COVID. COVID-19 has had a disproportionate effect on people with long-term health conditions, as we kind of is now sort of more widely recognised. This group have experienced higher mortality rates. So that's obviously a huge impact, but also this group of people have been advised to shield themselves, and that comes with its risk itself of being increased social isolation and loneliness. And as that shielding period ends, as we come into August, they may also experience heightened fear and anxiety around going outside. So what has become clear is as the lockdown restrictions have eased, the insight work has showed us that although people have been able to do more physical activity outside, and as you know, sort of gyms and leisure centres have opened, people with long-term health conditions have remained significantly less likely to be physically active compared to people without a long-term health condition. So it suggests that there are still ongoing challenges for many people as we sort of move out of the initial phase into the recovery phase of how we can support people with long-term health conditions to become more active. And I think this is really where the role of the link worker can be really important. So as we know, the role of the link worker has sort of adapted over the sort of pandemic period. We recognise that link workers have been at the forefront of the NHS and the voluntary sector response to the pandemic. Link workers have been supporting individuals who have been shielding with telephone support, alongside managing their previous caseload of people that were already accessing social prescribing services. In many instances, this has meant a change in responsibilities and how the social prescribing service is delivered. For example, link workers have taken on a larger cohort of people that have been referred in from GPs that are then their vulnerable patient list, who have previously were unknown to link workers. So they've had to manage sort of a larger, more diverse sort of patient group. There's also been certain link worker services or social prescribing services that have had to organise the Good SAN volunteer support. So that has meant coordinating the volunteers who have come forward with obviously the shielding individuals and supplying them with support through that mechanism. So although now that initial response sort of from March onwards to now was very much focused on ensuring the most important needs were met for people, so the people could receive, who are shielding, could receive food and medicine. There is a sense now that maybe from the link workers that certainly I work with, that they're moving into more of a recovery phase now, a different phase from the kind of sort of emergency work they were doing initially. As the shielding period ends, they feel that the support they can offer will change, and you know, the support that link workers are able to give to people may go back to something more like what it was pre-pandemic. So I think, again, just to reiterate that the role of the link worker, you're very much in a unique position to work with individuals who are able now to be more physically active and may need additional support to be physically active, because you access people who are managing long-term health conditions. You'll be working with people who are lonely or socially isolated, which is again just been exacerbated by COVID-19. You'll also probably be working with a large cohort of people who have been shielding and are therefore at risk maybe of deconditioning because they haven't been outside of the house for now over 4 months. And of course, you will no doubt be supporting individuals who are recovering from COVID-19. So I think, again, just reiterating what we kind of went through on the initial training programme, there is a lot of opportunities for link workers to support increases in physical activity through the work that you do. And those tools and resources to do that have already been developed by the National Academy for Social Prescribing to support those type of conversations where you can encourage people to make positive changes in their behaviour. And I'll talk a little bit more about that and the resources that we have with our training programme in the next slide. So if we think back to where the training was, we talked a lot around behaviour change techniques. We talked definitely around the COM-BB model and how that can be used to sort of encourage behaviour change in physical activity. And I don't want to sort of go into that too much at the moment because we talked a lot about in the training, but just to revisit what that model actually is might be helpful at this stage so you can kind of refresh your learning from that session. To those of you who didn't attend the initial session, I'll give a very brief overview of what this model is, and you may already be aware of it through work that you're doing. It's a quick reminder, the model shows that behaviour is an interaction between the capability to perform a behaviour and the opportunity and motivation to carry that behaviour out. A new behaviour requires change in one or more of these factors. And the arrows in the model describe the relationship between the factors. So as you can see, motivation is a central factor for changing behaviour, and that is influenced by someone's capability and opportunity to do the particular behaviour that you're asking them to change, in this case, physical activity. The first part of the COM-BB model is capability. So I just want to talk a little bit around this in terms of what capability is and how you can improve capability, bearing in mind the worries that people may have due to COVID-19. So capability is really, it comes in two different forms. It comes in the term of physical skills, so how capable someone feels that they're able to do something, but it also comes in the form of psychological knowledge. So what do they know about the action that you're asking them to do? Do people understand why being physically active is important? And do they feel able to do that? So, for example, if you're trying to help someone currently to improve their capability, you really need to think around asking them, how has the pandemic impacted on how capable you feel to be physically active? And these are the type of questions on this slide that you could use to explore that with someone who you're trying to provide support to. In terms of motivation, as I said before, is the actual sort of central part of this model. And motivation is very important as it allows you to use emotion to try and override someone's automatic tendency not to be physically active. So it's around giving them positive experiences that they can reflect on and then use to encourage themselves to be more physically active and engage in sport and physical activity. So when you're asking someone in terms of trying to get them to think of a reason why they should and shouldn't be physically active, it's good to use reflective sort of techniques where people are able to weigh up the pros and cons, and whilst doing this, they're setting short, medium and long-term goals. So again, these are all important questions to ask someone you're supporting, but you do need to now think around that in a COVID lens, where you think, okay, so people may be bringing up different pros and cons now to what they did previously. So, for example, people may feel worried and concerned around going outside and being in a group of people to do an exercise class. They may feel anxious around wearing a mask or going into a park if it's busy. So these are now new things, sort of factors that we need to consider when working with people around their reflective motivation and addressing those worries and concerns to help alleviate them. There's also something we need to be mindful of around setting goals. So it is very important now to consider when setting short, medium and long-term goals that we may be coming into a second wave of the pandemic and are vulnerable to local and national lockdowns. And so we need to think around how can we support people if this was to happen again, and have a plan in place for them to be physically active if they do need to go back to being housebound or shielding or restricted access to facilities. The final part of the model is around opportunity. And I guess arguably this has been the part of the model that's been most affected by COVID-19, because it's around do people have the opportunity to be physically active in terms of the context that they are they able to access parks, green spaces, blue spaces? Do they feel that they are have the knowledge of places where they can go safely, where that won't be too busy? And I think, again, it's just recognizing that this, when you're working with someone to try and increase their opportunities to be physically active, that you can ask them these questions that allow you to explore the potential worries that people may have, but also they can plan ahead for the opportunities that will allow them to be physically active. And I think certainly around the items that people should take with them in terms of a mask, in terms of hand sanitizer, a towel, their own water. These are all things that we need to explore with people to anticipate worries that they might have in the new context that we're sort of operating in. The important thing also just to pull out, and I think Barry mentioned this early on with the Sport England insight, is that social norms around physical activity seem to have changed, in that at the beginning of the pandemic, physical activity was very much sort of normalised. Everybody was very much encouraged nationally to go out and walk, because that's really or cycle or run, because that was the only opportunity we had to be outside. And you know, this potentially broke down a lot of barriers for people who had previously been physically inactive or didn't really engage with those forms of physical activity. And I think there's an opportunity here to work with people whose close friends and family may be now more sort of open to being more physically active, and how can the person you support draw in that support from their friends and family to change their own behaviour. Okay, so just to sort of finish up on the combi model, what we have here is a resource that's been developed by Sport England called Join the Movement. And I've included the link here on the slide, which you can look at, and you can see on there that it has a suite of resources available to help people become more physically active, engage in any type of physical activity, whether that be housebound, so chair activities, or online classes in your home, and also things around getting active outdoors as well. And those exercises are there for all different levels and a wide range of kind of classes that are online and available for people to engage with. So it's a really useful suite of tools that you can refer your patients to, or the people you're supporting, to start exploring the type of things that could really help them in terms of getting people back being physically active, or just increasing any kind of physical activity they're already doing. And also quite nicely, it has resources on there that enable people to make a plan and set goals, which we know are really key behaviour change techniques that work really well for people when we're trying to get them to change their behaviour. So just to sort of really summarise how link workers like yourself and social prescribers can really support people becoming more physically active sort of in the current context that we're in. And for me, there's 5 key things that as link workers you've got a real advantage of being able to do. So you can offer practical and accessible solutions. There are lots of resources out there now that are freely available for people to work to encourage people to be more physically active, but also for those activities to be housebound, but also outside as well. So you just need to be able to consider that suite and work together with the person that you're supporting to be able to find suitable options for them. And the other option, of course, is we don't only have online resources, but there are a range of activities or suggestions that cater for all abilities that can be accessed through your local active partnership. So we'll talk a little bit more about that at the end of the presentation. But every county has an active partnership, and they will have a fantastic sort of resources at their disposal to understanding what physical activity is going on in the local area. And of course, London Sport is the one that would cover London. And I think, you've got an opportunity to really just reinforce any type of physical activity that people are doing. And we talked about this a little bit in the training, how, the benefit of having continued support with someone, if you providing continued support, you're able to follow up their short-term goals and medium-term goals and really work with them to understand the barriers and challenges that are coming up while they're trying to be more physically active. And that actually doesn't change necessarily in the current context. It just, with COVID-19, it brings in new considerations for people that we need to think around the potential barriers and worries that people will have. And also there are definitely sections of the population, as we've already highlighted, people who have been shielding or people with long-term health conditions that have really kind of been unable potentially to do any kind of physical activity and may need some more intensive support to get them moving again. And of course, we've got all the suites of resources available that you're able to do that. So we've got action plans and we've got goal setting ability. We can think around how we use those plans along with the National Association of Social Prescribing resources that are available, just to really work holistically with the people that you're supporting, just to sort of get them through the next stage really of being able to increase their ability to do more physical activity, but also embed that people will have safety concerns that are specific to COVID-19. Okay, so just moving on briefly around some very specific advice and considerations around COVID-19 that we kind of need to sort of consider in when we're giving advice to people. So, and this is something that you're probably already aware of because you're constantly working with people anyway through telephone support, maybe, and maybe even virtual support now, that people still have concerns around going outside, around meeting in groups, meeting inside, seeing new people. And this is not specific to people who are just shielding, it's, across whole sections of the population. But, I think we've got to acknowledge that safety concerns are going to be a really big part of whether people want to get back to being physically active. And I think we just have to acknowledge that, but there are things that we can do to sort of ease people's concerns. And, it's around providing solutions for people based on the worries and concerns that they have. And again, these may be multifaceted, but from my experience, the concerns people are bringing up around, will I be able to wash my hands? How do I maintain good hand hygiene outside? I don't know if there's going to be facilities available. I don't know if the venue I'm going to is going to be really busy. I don't understand if I have to wear a mask there. And so, but these are all things that can be worked through with someone as and when you're supporting them to be physically active. And you can put in coping mechanisms and for these particular worries and concerns and include them in the action plans that we're setting. And again, this is all using motivational interviewing techniques which are techniques that we went through in the training very briefly, but from recollection, I think most of you had really good understanding of those techniques and used them already in the way that you were working with people. So again, it's just using the skills that you already have to just reinforce people's confidence around being more physically active with COVID-19. Okay, so again, just want to sort of finish up really, just thinking it highlights some more really useful resources, I think, that you can use yourself to build knowledge and understanding around what is available, but they're actually also targeted at supporting people, patients or service users. So the We Are Undefeatable campaign, which is run by Sport England, was running prior to COVID, but it has adapted some of its content and generated new content around ways to move with if you have a long-term health condition and you need ideas around how to stay physically active with restricted access to venues or to being shielding. So that's a fantastic resource that people can use, tap into, and give you ideas around exercises to do and for people just to browse through. We've also got to think around the role of link workers in the recovery from COVID-19. So as is becoming more and more apparent from evidence that there are recovering from COVID-19 is actually a very sort of intensive sort of period in people's lives. It's not necessarily that they come out of hospital and are immediately okay. Even people who haven't been admitted to hospital are reporting sort of quite severe sort of impacts on their mental health and physical health. And in recognition of this, the NHS have now developed a 12-week programme to support people who are recovering from COVID-19. And the important thing to highlight in this, I guess, for the purpose of this webinar, is that it does have an exercise element to it to get people more active, but at a very slow kind of pace, recognising that obviously they have lung damage and their muscle strength is much depleted. And at the moment, it's just GPs that can refer people into this programme, but there is talk around that may extend out to other people working in primary care. So one final slide, again, just on recovery. I think it's also really important to be able to sort of give yourself as practitioners and as healthcare professionals to have some resources to understand how you can help people who are recovering from COVID-19. And the moving medicine side does give you as a practitioner lots of resources and advice around how to, what you should be advising people to do and how you can do that given that they are recovering from COVID-19. So this is a good website to go to for yourselves. It also is a good website, again, another website where it has patient-facing resources and that give reassurance to patients around the type of exercises they can do whilst recovering from COVID, and just sort of giving them a lot of mental health support and resources through that time. And the exercises that are on there are focused on bed exercises and standing exercises. They are designed specifically for people recovering from COVID-19, so they are a very low impact. So again, just another resource that you can use to improve your own knowledge and understanding, but also something that you're able to offer your patients advice and resources for them to help with their recovery. So one of the big issues that people have sort of noted, I guess, or big concerns are that when people are recovering from COVID, that they are very nervous and worried about going outside. Maybe because their muscle strength and fitness has decreased significantly and people don't feel as steady on their feet as they maybe did before and are worried certainly around falling and causing further damage. So Public Health England, again, have put together a very helpful booklet called Active at Home. And this really is a fantastic resource around encouraging people to start very slowly in terms of building up their particular strength, muscle strength, and that they would do at home, to enable them to feel more steady on their feet and to help their balance. So it's all around building up very slowly in the home before you even think about going outside. So again, just another resource that you can pull on for yourself, but also something that's very much designed for patients as a resource for them to be able to help with their recovery at home. So just to finish up, we've got some resources here that may be helpful to you that we've listed by type of resource or the organisation that has provided that resource. So London Sport have provided a suite of options that are available, and it's London specific advice around how you can support physical activity in COVID-19. But there's more also national advice from the national active partnerships that can be accessed via the link included in the slide. We've also got national guidance that has been produced by national bodies. So these are things that you may already be very familiar with because they've come across them in your role, but they are the most recent government guidance on COVID-19, the local government support that you're able to get from COVID-19, and also Sport England specific, I guess, support around physical activity. There's also some guidance here that we've grouped together that are specifically aimed at home-based exercises. So I've talked to these earlier in my presentation, but there's also a couple of new ones in there that really talk around chair-based exercises, but other type of exercises in the bed, but also just sort of exercises that can be done through online classes as well, and that are a bit more sort of, I guess, vigorous. But they're all able to be done at home. And so again, if people are still nervous around going out, then you can offer these resources to those individuals depending on their sort of position and what they feel comfortable doing in terms of physical activity. And then the Richmond group of charities has helpfully put together a list of specific guidance for people with long-term health conditions. And so I would urge you to go to that link if you want to look at specific guidance around diabetes or cardiovascular disease from the British Heart Foundation, for example, and they're able to provide more detailed guidance around supporting people with long-term health conditions in that sense. So just one more slide from me as a summary. So I think what we really want to emphasise together is that link workers now more than ever have an important role to play in supporting people to improve levels of physical activity. This is especially pertinent at the moment because shielding is about to end for a whole cohort of people who have potentially been physically inactive for over 4 months. So with that comes a risk of deconditioning and a potential increase in falls. And so there's an opportunity now really where link workers will be seeing these people, have been already working with these people, and there's an opportunity there to try and think around how can you now start to get people more physically active and decreasing their sedentary behaviour. And, you know, I think that's a really key thing to sort of highlight is that link workers have a, you know, they have a, you cover a wide group of individuals who will benefit from being more physically active, and that's just we've just named 3 groups of them here, but I'm sure obviously there's probably more people, but I think it's a real opportunity at the moment, especially to support those people that are about to restart being physically active safely because they're going to come out of shielding, but also there's a group of people who will be recovering from COVID-19 who will need support around becoming physically active again.
Okay, thanks, Sarah, and thanks for that presentation. Really, really useful information. I hope it's been useful to our listeners. We're just going to talk now a little bit about the one-day training programme that was available before the coronavirus and will be available once we're able to get back to normal routine. If you haven't received the one-day training course and you live in London, it's still available. If you're an individual social prescriber or link worker, or you're a manager of a programme, please contact me on the email there and we can talk about how we can arrange delivering that training. And it is free in London. If you live outside London, then the training may also be available via your active partnership network. Again, to find your nearest active partnership, if you don't know it, the link is there and you'll then be directed to your local county active partnership. Next slide, Sarah, please. Finally, if you've got any questions, please do feel free on today's session. Please feel free to contact Sarah or myself, and we'll be glad to help you. And once again, if you haven't received the training session, the links are there. Please do get in touch, and we'd like to thank everyone for listening today. We hope you found it useful.